Have you ever felt your heart racing for no reason at all? Have you ever felt like your heart was about to stop beating? A sensation of palpitations? Have you ever felt this? Or do you know someone who has? Then watch this video until the end and share it. Today, we're going to talk about arrhythmia. So, what exactly is arrhythmia? What is this palpitation? It's normal for the heart to beat. What isn't normal is actually noticing your heart beating. So, if you notice your heart beating, that's not normal and it could mean something is wrong. The heart beats in a regular rhythm, so some irregular beats can give you the sensation of palpitations, which is the feeling of your heart beating irregularly. So, it's important to understand what this really is, whether it's an arrhythmia and if it's a serious arrhythmia or not. So today we're going to talk about this arrhythmia. I'm Dr. Kristen Souza. I'm a cardiologist. I've been practicing for over 20 years and have had a cardiology practice for 15 years. And this video is one of several where we talk about diseases, symptoms, and how you can take better care of yourself. There's a song that goes like this: the heart races, stumbles, almost stops. That's not passion. No, that's not love. No, that's arrhythmia, okay? So go see a doctor. Jokes aside, what is arrhythmia? Arrhythmia comes from the word meaning absence of rhythm. Our heart beats close to 100,000 times a day without stopping, without missing a beat. At least, there shouldn't be any pauses or failures. So these heartbeats are regular. And when you have an absence of rhythm, you have arrhythmia. This rhythm is controlled by a specialized organ. It's called the natural pacemaker or sinus node. That's where the term sinus rhythm comes from, which is the normal heartbeat. Our brain sends commands through the nerves to the striated skeletal muscles. So the brain sends a command to the arm muscle and makes the arm move. But in the heart, you don't have a command coming from the brain. This command comes from the sinus node, and it sends out this command about 100,000 times a day in a regular and rhythmic way, which is the sinus rhythm. As I said, the heart beats close to 100,000 times a day. And when you have this arrhythmia, you're out of the normal rhythm. So you might feel your heart beating, feel like it's skipping, feel like it's beating faster or slower, or like it's stumbling, right? The heart is stumbling. This feeling is either a skip or a sensation that the heart is stopping. And this feeling is what we call a palpitation. This palpitation should be investigated so we can try to find out exactly what type of arrhythmia the person is experiencing. So this would be a normal heart with a normal heartbeat. Notice that the beats are regular. And now you're seeing an irregular beat, an irregular rhythm, an arrhythmia. So this is a heart with arrhythmia. So the sinus node is like a conductor, and the structure of the heart is like an instrument. The conductor gives the cue, and the instrument follows the rhythm. However, if there's any kind of miscommunication between the conductor and the instrument, you end up with music that's out of rhythm. In this case here, if the rhythm isn't the sinus rhythm, if the rhythm isn't being controlled by the sinus node, then we can have a lack of rhythm, an arrhythmia. There are nerves that come out of the sinus node and go to the heart, and if any of these nerve bundles have a failure, that's what we call a bundle branch block, which isn't necessarily an arrhythmia, but rather a communication failure. And we often hear people say, I have a right bundle branch block or a left bundle branch block. This isn't necessarily an arrhythmia. It is, in fact, a change in that nerve bundle. But when there's a communication failure and the rhythm goes off track, that's what we call an arrhythmia. There are 4 main types of these arrhythmias. The first one I'm going to talk to you about is an extrasystole. Then there's tachycardia, tachyarrhythmia, bradyarrhythmia, and atrial fibrillation. Tachyarrhythmia is when the heart speeds up disproportionately. Here's the thing. When we exercise, it's normal for the heart to beat a little faster. That's physiological. But for the heart to speed up while at rest, that's not normal. And bradyarrhythmia is when the heart is beating slowly. much slower than it should. So with tachyarrhythmia, the heart speeds up. With bradyarrhythmia, the heart is very slow. Extrasystole can happen once, twice, even up to 500 times a day in isolation, and it's not a disease. There's no problem with it. However, if you're noticing this extrasystole, this extra heartbeat, this feeling of your heart skipping, that's not normal anymore. And if you have more than 500 isolated extrasystoles a day, which we usually can't count because we don't notice them, but it can be documented with a test called a 24-hour Holter monitor, then that would already be considered abnormal. It's an arrhythmia that should be investigated and treated. So these are the extrasystoles, tachyarrhythmias, and bradyarrhythmias. Before we talk about the four main types of arrhythmia, I need to explain to you, and we need to know how to differentiate what is an arrhythmia related to the structure of the heart, what is a true cardiac arrhythmia, and what is an arrhythmia that is provoked. Are there some extra cardiac causes that could provoke an arrhythmia? Yes, and we need to learn how to identify them. That's why it's important during a conversation, when I'm talking to a patient, when I'm taking their medical history, I ask a lot of questions, including what they eat, what they're feeling, and sometimes we can even spot some problems just by looking at them. What kinds of problems? Let's go. Causes of arrhythmia that aren't necessarily related to the heart. Number one, by far, caffeine use. Excessive caffeine consumption is one of the main causes of arrhythmia. Caffeine can be found in mate tea, green tea, and black tea. When we say green tea, we don't mean tea that's green in color, like mint tea or lemon balm tea. A lot of patients have trouble with this distinction. There is a tea called green tea. It's this tea called green tea that can contain caffeine. It's even used to make matcha, right? And there are teas, some people even use this green tea in capsule form, including for weight loss, because it helps with losing weight. So these teas, the ones called green tea, those contain caffeine. Peppermint tea and lemon balm tea don't have caffeine, so you can use them without any worries. Yeah, besides caffeine, alcohol is also very interesting. Alcohol can indeed trigger an arrhythmia, and we even call it a normal heart arrhythmia. That's really interesting. It's called holiday heart or holiday heart syndrome. So the person, they are stressed, which is it's the third cause of arrhythmia. They're stressed, they're tired. It's like that during the day, week. When the weekend arrives, what will she do? She's gonna drink. And when she drinks too much and Monday comes around, what happens? An arrhythmia. So this Monday arrhythmia, or holiday heart arrhythmia as we call it, is a normal heart arrhythmia, especially caused by accumulated stress associated with alcohol consumption, and sometimes also associated with a fourth cause, which is precisely sleep deprivation, which is usually related to the other causes as well. So these are the main exogenous causes, as we say, which are sometimes considered harmless. But there is another cause, which is medication. That is well known to provoke arrhythmias. So there are many medications. I won't list them all here, but it's important for you to understand that when your doctor prescribes you a medication, sometimes they also order a test called an electrocardiogram and say, look, you're going to start this medication and you'll need to do an electrocardiogram. You should understand that this medication can potentially cause arrhythmia. So you need to do an electrocardiogram before starting and after you've started this medication. There are some diseases that can cause arrhythmia. Remember I told you that sometimes we can identify it just by looking? I'll never forget a patient I saw in the emergency room at INCOR. I looked at the patient and said, this patient has arrhythmia and I know the cause. I was a second-year resident, and the first-year resident looked at the patient and said, what are you talking about? I don't see anything. The patient had an enlarged thyroid. His eyes were wide open. He had what we call thyrotoxosis. So some thyroid problems can also cause arrhythmia. So these are the main non-cardiac causes. And now let's talk about the four main cardiac causes, or actually four types of heart arrhythmias, okay? So let's talk now about the four types of arrhythmia. Four main types of cardiac origin. And extrasystole. What is an extrasystole? The heart is beating in one rhythm, and then suddenly it goes out of rhythm. Just one beat out of rhythm. I use the term, it's like a piston is out of time, And sometimes you really get the feeling that your heart has stumbled. So, yeah, this stumble, this extra systole, it can be rare or it can be frequent. Like I said, our heart beats close to 100,000 times a day. If you have up to 500 extra systoles a day, by the way, this has to be documented with a test called a 24-hour Holter, then you really have a rare extra systole up to 500 times a day isolated. If you have more than 500 isolated extrasystoles per day, or if you have pairs, conjugated extrasystoles, then you already have an arrhythmia that deserves a little more attention. The other cause is tachyarrhythmia. This means the heart is beating faster than necessary and out of rhythm. It's normal for the heart to speed up a bit and in a controlled way when we exercise. If this speeding up gets out of control, it's a tachyarrhythmia. And it's normal for our heart rate to slow down a bit while we sleep. But if the heartbeat is too slow and out of control, that's a bradyarrhythmia. And the fourth arrhythmia, which is actually one of the most common causes, including of stroke, cerebrovascular accident, or what we know as a CVA, is atrial fibrillation. Atrial fibrillation, understand that it needs to be treated and controlled, and you have to use certain medications to prevent a stroke from happening. So, atrial fibrillation needs to be properly diagnosed and treated. What exactly is atrial fibrillation? It's when the heart is constantly out of rhythm. It's one of the most common arrhythmias, the classic example of arrhythmia, really, because the heart seems like, well, popcorn popping in a pan? You never know when it's going to be. So instead of the heart beating like thump, 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 it's more like thump, 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 thump. It's out of rhythm. So, as I said, these are the main types of arrhythmia that need to be monitored, diagnosed, and treated. Doctor, but after all, when should I be concerned and what should I do? So, there are 6 symptoms. The first 3 are concerning, but the last 3 are alarming. If you feel your heart beating irregularly, have a prolonged palpitation, or frequent palpitations that come and go, or if you're feeling a bit dizzy, you should see a doctor quickly. Now, if along with a racing heart, you also feel shortness of breath, chest pain, or fainting, which we call syncope or pre-syncope, that feeling like you're about to pass out, that's very concerning. It's an alarm symptom. You should immediately seek urgent care, an emergency room, or an ER. This could be something very serious and could be putting your life at risk. So please, these symptoms are emergency symptoms. So to prevent problems, it's important for you to understand what's happening with you, pay attention to the signs and symptoms you feel, and when you notice something, see a doctor. And if you're not feeling anything, that's okay. But you should still take care of yourself anyway. Hell, by exercising, watching your diet, and avoiding excessive caffeine and alcohol consumption, like we mentioned. And especially if you enjoyed this video, please share, like, and subscribe to our channel. If you want more information, always follow our channel. We always have useful information for you and your family. And remember, it's important to take care of your health. And health is more than just aesthetics. Health is performance and longevity. I am Dr. Christian Souza. I want what's best for you. Good dog. Until later.